I didn't know if just 1 week of training would make me feel confident into going out. We come from all over the country, really. And so when the training is finished, we kind of go into our own little world, and it's kind of scary to be left alone. But he provided me, I bought some of the videos, and he had some audio. I bought some of the books, and really spent some time in dissecting everything that we learned, and felt quite confident in a few weeks to at least utilize a part of the training. And to my amazement, I work with drug and alcohol and mental health clients, and to my amazement, it wasn't very hard for clients to pick up on a lot of the techniques and to utilize the techniques very rapidly. And for me, my main purpose as a therapist is to instill change in people. I don't want to waste people's time. I do not want to be known as, someone that's ineffective. And coming here, it gave me a new sense of purpose, and just kind of breathed life into me. Because I'm from the traditional school, you learn this technique or this theory, and theory's great. I mean, John Connelly is based on theory, but there's a lot of time and a lot of pain that I've seen clients go through with other theoretical movements. And I didn't see that with Dr. Connelly. I saw hope and inspiration and instillment to learn more about it for the clients. I'm seeing behaviors change immediately. I'm seeing it's so rational and it's so logical, which you think that talking about the unconscious or the subconscious is not something that's rational or logical. So I see them grasping onto these concepts and utilizing them in their everyday life. Clients know what they want. Clients come to you and immediately have a desire to make specific changes. And I think with Dr. Connelly's techniques, we're able to utilize those specific techniques to deal directly with that problem. We're not beating around to, when they were 3 and working their way up until their adulthood and finding out every little problem that they've had all their life. We're going right in, we're dealing specifically with the problem, and there's a total resolution when they leave. I think my clients have expressed, I've been kind of known as the therapist that does different things. And so the clients that call me are there that have already gone through the traditional therapies and have not had very much success, or have been re-traumatized, and they've stood away from therapy thinking that maybe this thing isn't right for me and that I'll never be helped. And so I think with coming into the arena of therapy with new concepts and innovative concepts that almost guarantee results immediately, it renews their faith and hope that maybe this will work for me. So when they come to see me and know that I'm not the traditional therapist, right there, change is occurring. Well, as I said, Dr. Connelly's theory is very direct, but I'm not imposing my thought and belief on you to make the changes that need to happen. The changes are already desired in the client, and so they bring their ideas and concepts to me. And the techniques that Dr. Connelly shows us is that we use the client's own experiences and ideas and thoughts as their own solution. I don't have to retrain them, reprogram them, give them new coping skills, or any of that. They already have the power within themselves to change. It's just the awakening of that power. I think if you're even considering coming to this training, you just do it. You need to do it. You owe it to yourself to do it. Get in the car. I can't think of anything more rewarding. It is an experience that you will not get anywhere else. I guarantee that.